My name is Samantha Saldana, and today we will be talking about Parkinson's disease, including causes, symptoms, and treatments of the disease. First off, what is Parkinson's disease? It is a progressive disease of the nervous system. It affects movement, and this is manifested usually in tremors, and this can often be of the hands, but also of the legs and jaws of the patient. There is also stiffness of the trunk and limbs, and this greatly affects walking in the patients. There is also usually, in the beginning stages, slowed or slurred speech that shows itself in patients that are acquiring Parkinson's disease. There is currently no cure for Parkinson's disease. However, there is a management of symptoms, and these are usually quite effective in the beginning and mid stages. Next off, we're going to talk about stages of the disease. So in stage 1, we have a mild stage. Tremors and symptoms are restricted to one side of the body. The second stage is a more moderate stage. There's stiffness and tremors are more noticeable. Facial expressions may also be affected, and symptoms are now apparent on both sides of the body. Stage 3 is the mid stage. There is a loss of balance, and decreased reflexes are added to the list of symptoms, and these are usually treated with occupational therapy and medication. Stage 4 is a progressive stage. Patients have great trouble moving, and they need assistance moving, but however can stand on their own at this stage. Stage 5 is the most advanced stage of Parkinson's. The patients usually have stiffness of the legs, and this causes freezing when standing. They can't stand without falling and may have hallucinations and delusions at this stage. Next off, we're going to talk about causes of the disease. There is a progressive deterioration of the neurons in the substantia gria, and normally these neurons produce dopamine, so there is a marked decrease of dopamine in Parkinson's patients. With less dopamine, the person has less ability to regulate movements, emotions, and their body. Why is dopamine important? Well, dopamine is a neurotransmitter, and it allows for communication between the substantia gria to the striatum. This is a picture showing what happens with dopamine in a Parkinson's patient. So with a normal patient, you see a lot of dopamine being transmitted, and this allows for normal movement. However, in Parkinson's patients, there is a lack of dopamine, and this manifests itself in movement disorders. This right here is a PET scan, and it highlights the loss of dopamine storage capacity in Parkinson's patients. So the red and yellow areas show dopamine concentration in the midbrain of both patients. There is a marked dopamine deficiency in Parkinson's, so you can see how there's less yellow and red in the Parkinson's patient on the right. Why do some people acquire the disease? Well, the exact cause is unknown. There are many factors that we know that contribute to the disease. So first off, your genes. Specific gene mutations can cause Parkinson's. This is mostly in cases with many family members affected by the disease. And there are also environmental triggers like toxins. These can be external or internal toxins that can destroy dopaminergic neurons. These toxins include magnesium, carbon monoxide, carbon disulfide, and other pesticides. So certain jobs have obviously more exposure to toxins, and those workers can be more prone to develop Parkinson's later on in their life. There is also oxidative stress that attribute to acquiring Parkinson's disease. This picture here just demonstrates the type, this is what a neuron looks like, and you would typically find them in the substantia gria. Next off, we're going to talk about motor symptoms of Parkinson's disease patients. There is a slowness of movement in patients. There is also involuntary shaking or tremor at rest. This is usually in the hands, but can also be in the jaw and legs. There is stiffness of the muscles of the arms, legs, or trunk, and this can greatly affect walking and later standing in the patient. There is also trouble with balance, which is called posterior instability. So in the picture, we show many of these symptoms manifested in a Parkinson's patient. There are trembling of the extremities, rigidity of the trunk, stooped posture, forward tilt of the trunk, and then slightly flexed hips and knees. And this usually shows itself in shuffling and short, steep steps gaits. In addition to motor symptoms, there can be secondary motor symptoms. There can be freezing, causes fear to put the foot forward, and this comes from stiffness of the legs in the patient. There is also micrographia, which is a result of the shrinking handwriting of many Parkinson's patients. Next off, we're going to talk about non-motor symptoms of the patients, and these are many. There can be motor disorders, cognitive changes, difficulty with attention, planning, language, and memory. There can be hallucinations and delusions, sleep disorders, constipation and early satiety, vision problems, excessive sweating, loss of a sense of smell, and sexual problems all manifest themselves in Parkinson's patients. So how can we treat Parkinson's? Well, first off, there's medications. These medications usually help with problems with walking, movement, and tremors, so they treat symptoms of the disease. They can increase or substitute for dopamine. However, dopamine cannot be given directly to Parkinson's patients because it cannot enter the brain. And right here is a list of the typical medications you would find for a Parkinson's patient, but there are many more medications out there. The second option for treatment would be surgery. This is usually only considered when medication is inadequate to control for symptoms. There are two types of surgery: paligodectomy, which destroys the overactive globus pallidus, a part of the brain that's overactive in people with Parkinson's. And there's a taligodectomy, which destroys part of the thalamus to block the abnormal brain activity from reaching the muscles and causing tremors. This type of surgery only affects tremors with the patients. So this is where the globus pallidus is, and this is where the thalamus is. And these are my citations. Thank you for listening to my lecture.